MASI. Thrombotic microangiopathy is a very rare but a serious condition characterized by occlusive microvascular thrombotic and secondary hemophilia, and it is a matter of hemolytic uremic syndrome and thrombotic thrombocytopenic purpura.
Patients with the following conditions should be considered for kidney transplantation. Thrombotic microangiopathy, or hemolytic uremic syndrome, is a disease of unknown origin characterized by abnormally low levels of platelets in the blood, the formation of blood clots in the arterioles and capillaries of many organs, and neurological damage. Antiglomerular basement membrane disease can be defined by the presence of a triad of glomerulonephritis, pulmonary hemorrhage, and anti-GBM antibodies. Primary or secondary amyloidosis develops when specific proteins known as amyloids are abnormally deposited in the tissues and organs of the body. The deposited amyloids impair the function of organs, making the condition potentially fatal. Systemic lupus erythematosus is a chronic inflammatory autoimmune disorder. It may affect the skin, joints, kidneys, and other organs.
In medicine, recombinant interferon beta thrombotic microangiopathy. Healthcare professionals are advised to be vigilant for symptoms and signs that might be an early indication of this complication in patients receiving recombinant interferon beta. We are investigating a cluster of reports of thrombotic microangiopathy with recombinant interferon beta, which is used in the treatment of multiple sclerosis.
Blood cells are produced in the bone marrow. The three main components of blood are red blood cells, which carry oxygen, white blood cells, or leukocytes, which fight infection, and platelets, also called thrombocytes, which assist in the formation of blood clots. When a blood vessel is damaged, platelets adhere to the surface of the damaged vessel and release chemicals. These chemicals attract more platelets as well as red blood cells in order to form a clot or thrombus. As the clot grows, the blood vessel narrows, thereby decreasing blood loss. This process is called coagulation. Normal platelet counts are in the range of 150,000 to 350,000 platelets per microliter. Thrombocytopenia is a disorder in which there are not enough platelets. When the platelet count is decreased, the body is unable to form blood clots and therefore is unable to control bleeding. Bruising and bleeding can occur from relatively little trauma. When the platelet count gets below 10,000 platelets per microliter, bleeding can develop without trauma. Chemotherapy-induced thrombocytopenia is a disorder that develops as an adverse effect of chemotherapy. Cancer drugs not only kill cancer cells, they can also damage the platelet-forming cells in the bone marrow. The severity of this disorder depends on the type of chemotherapy and the duration of treatment. Fortunately, chemotherapy-induced thrombocytopenia can be managed with platelet transfusions, additional medications such as blood cell growth factors, or with blood stem cell transplants.
Pros and cons. Signs and symptoms. The clinical presentation of treatment often depending on the times, typically includes pervert microangiopathy, hemolytic anemia, cytotoxicity in a blood small, renal failure, thrombocytopenia, neurological manifestation. Generality renal complications are particular predominant with symptoms associated hemolytic uremic syndrome and atypical, where neurologic complications are more likely with TTP. Individual with milder form of TPI might have recurrent symptoms episodic, including
blood clotting is a natural process and may be triggered by the body in response to a cut or a wound. In a relatively complex process called coagulation, a plug is formed that stops too much bleeding from minor wounds. Sometimes coagulation is triggered inappropriately and a clot forms in one of the large veins in the leg, pelvis, abdomen, or more rarely in the arms when it's not needed to prevent blood loss. The medical name for this condition is deep vein thrombosis, or DVT. You may have already experienced symptoms such as swelling, pain, and discoloration of the affected arm or leg, indicating that you're suffering from a DVT. There are several factors that may increase your risk of developing a DVT. These include age, being overweight, extended periods of bed rest, such as during a stay in hospital, limited blood flow in a deep vein due to injury or surgery, cancer and some of its treatments, or a family history of blood clots. You may also be at an increased risk if you've had a prior thrombosis. However, it's also important to note that in many cases, your doctor may not be able to find a risk factor.
Thrombotic thrombocytopenia purpura is a rare disorder of the blood coagulation system, causing extensive microscopic clot to form in the small blood vessel throughout the body. Thank you.
Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition.
Page 359. What is thrombotic thrombocytopenic purpura? Or this, it would lead to a decrease in degradation of the von Willebrand factor multimers. Describe the pathogenesis of thrombotic thrombocytopenic purpura. In thrombotic thrombocytopenic purpura, you have an increase in the large von Willebrand factor multimers. These would lead to increase in platelet aggregation at these von Willebrand factors and eventually leading to thrombosis. Describe the lab findings you would see in thrombotic thrombocytopenic purpura and why. In thrombotic thrombocytopenic purpura, you would also see formations of schistocytes, and the reason for the formation of these schistocytes or helmet cells is due to the mechanical destructions that would occur, and that is because of all the thrombosis that's going on, which would narrow the lumen and cause mechanical destruction. Along with schistocyte formation, there would also be an increase in lactate dehydrogenase, and as we know, lactate dehydrogenase is increased whenever there is hemolysis. What is the symptoms pentad of thrombotic thrombocytopenic purpura? The symptoms pentad, which means 5 symptoms of thrombotic thrombocytopenic purpura, is neurologic and renal symptoms, fever, thrombocytopenia, and microangiopathic hemolytic anemia.
For more information on this topic, click on the link in the description section below.